Nurse, good morning. How can I help you? Patient, good morning. I need to see the doctor. I'm not feeling well. Nurse, all right. Please write your name in the register and wait for a few minutes. Patient, okay, thank you. 2 minutes later. Nurse, ma'am, you may go inside. The doctor is ready. Doctor, hello, please come in. Patient, hello, doctor. Doctor, please have a seat. Tell me what's bothering you today. Patient, doctor, I've been feeling sick since last night. I have a strong headache, fever, and body pain. Doctor, I understand. Are you feeling dizzy as well? Patient, yes, a little bit, especially when I stand up. Doctor, okay, any cough or cold? Patient, I have a little cold but no cough. Doctor, did you eat anything outside yesterday? Patient, yes, I had street food with my friends. Doctor, that might be one reason. Doctor, are you sleeping well these days? Patient, not really. For the last few days, I've been sleeping late. Doctor, all right, let me check your temperature first. Doctor checks temperature. Doctor, your temperature is 101 degrees Fahrenheit. Patient, is it something serious? Doctor, not at all. It seems like a viral infection with a mild cold. Doctor, let me also check your blood pressure. Doctor checks BP. Doctor, your blood pressure is normal. Nothing to worry about. Doctor, are you drinking enough water? Patient, honestly, not much. Doctor, you should drink at least 2-3 liters every day. It helps reduce fatigue. Doctor, do you have any medical history, diabetes or allergies? Patient, no, nothing like that. Doctor, good. Doctor, viral infections usually last 2-3 days. You just need rest, proper food, and medication. Patient, okay, doctor. Doctor, your body pain is because of dehydration and lack of sleep. Doctor, I am prescribing you 3 things. 1. Fever tablet twice a day after meals. 2. Sore throat syrup, 10 milliliters 2 times a day. 3. Vitamin C tablets, 1 tablet daily for energy. Doctor, take these medicines for 3 days. Patient, sure, doctor. Doctor, also follow these instructions. Drink warm water. Avoid cold drinks and ice cream. Eat light food like khichdi, dal, soup. Have enough sleep. Don't use mobile for long hours. Patient, all right, I will follow everything. Doctor, if you feel high fever, breathing difficulty, continuous vomiting, or no improvement after 2 days, then come back immediately. Patient, yes, doctor, I will. Doctor, take rest today and tomorrow. Don't go to work. Patient, okay, doctor, thank you so much. Doctor, get well soon. Take care. Patient, thank you, doctor. Nurse, please collect your prescription. Patient, thank you. Nurse, get well soon. Patient, thanks. Thank you for watching this video. I hope this doctor-patient conversation helped you learn useful English sentences for real-life situations. If you want more videos like this conversations, daily use English, and practical speaking lessons, then don't forget to like, share, and subscribe.